Welcome back. Well, imagine getting your dental work done in a comfortable, quick, and painless environment. Sounds too good to be true? Well, it is true. And Dr. Rick Coker from the Smile Studio joins us this morning. He's brought along with him Dr. Sean Thomas, who's an anesthesiologist who helps sedate us, makes us feel more comfortable when we get those, I guess, nerve-wracking dental procedures done. Thanks so much, both of y'all, for being here this morning.
Thank you.
So tell us about what kind of procedures sedation merits.
Well, essentially there are two different types of markets. One is a lot of people are choosing to have a lot of dentistry done. You know, everybody's so busy today.
Sure.
If they're trying to do their makeover, their smile, or trying to do something like that, just get it all done one day.
It makes sense.
Yeah. So in those cases, it's nice to be sedated. If you're going to be there for 4 or 5 hours, just get it over with.
Mm-hmm.
The second group of people that this is good for are people who are just so frightened of the dentist. Maybe they were hurt early in their lives, whatever. They just have anxiety driving by a dental office. There's a lot of those people. Well, this is a way to offer them the safety of having a physician to administer the sedation, to monitor it, to make sure. And from my perspective, I don't have to think about it. I don't have to worry about it. I can just take care of my treatment.
So it makes your work more effective.
Absolutely.
And Dr. Thomas, talk to us about how sedation works. If I were to go into Dr. Coker's office and get a procedure done, what would you do to me to make me feel more comfortable?
Basically, the nice thing about what we do is we're able to bring the same drugs, the same monitors that we use in the hospital setting in the operating room to Dr. Coker's office. So you're getting a controlled, monitored sedation in a controlled environment. So we're able to tailor for your individual needs just how much sedation you need at varying points in the procedure, all while we're monitoring all of your vital signs continuously throughout the procedure. It frees Dr. Coker up to do what he needs to do.
That's right, and it sounds very safe because, like you said, you're monitoring vital signs and I guess the physical state of the patient as well.
Absolutely. We're taking all aspects, again, from the operating room, taking that safety and moving it to his office in a situation where we give small, controlled doses, but we can give more if we need to. So,
what are the other benefits of sedation?
Actually, the benefit for me is that I'm relaxed because the patient's relaxed, the dentist relaxes, the staff, things work more smoothly, and actually they have less discomfort afterwards because they weren't uptight the whole time. That's what a lot of times discomfort happens. So the whole procedure will be smoother.
And then also, how about insurance? Will that cover the cost of the sedation as well?
I don't have any experience with, since we're just starting. Sometimes, Dr. Thomas can explain a little bit, sometimes it does.
In some cases, the medical insurance will pay for up to a certain percentage. In a lot of cases, that's 80%.
Oh, wow.
And it's based on the patient's inability to tolerate the procedure without sedation. And so we'll provide all that information if the patients want to follow the insurance themselves. They absolutely can. And the insurance companies have informed us that in a lot of cases, they'll pay up to 80%.
Any side effects from sedation?
Very little, because it's such a controlled situation, it's such a controlled dose, and most of the patients will be able to get up and walk out with assistance from their family members and be driven home that day.
Wow, that's fantastic. Well, if you have any questions for either Dr. Coker or Dr. Thomas about sedation, or any questions about your dental health, you can go ahead and call Dr. Coker over at his office, or log on to tylersedation.com, and we'll make sure that you get the information that you need. Gentlemen, thanks so much for being on our show this morning.
Thanks,
Great
Greg.
information. And it makes me a little less nervous next time I have to get a procedure done as well. Thanks so much for being here.
Thank you.
Brian?
Thank you.